Here's the deal. When we hear the words psychopathy and sociopathy, we think of them as two words that mean the same thing, right? We hear these terms thrown around in true crime stories, popular psychology videos, and even social media. However, the terms have distinct meanings, and this is especially important when we're discussing the brain, mental health, behavior, and the legal system. And that's why I discuss these terms in Volume 2 of my book, Forensic Neuropsychopathology, Clinical Insights into Brain Behavior, Mental Disorders, and the Legal System. For those of you all don't know me, my name is Dr. Chouraeshkenazi. I'm the CEO of the Chouraeshkenazi Group. I'm a clinical neuropsychometrician, author, researcher, scientist, and forensic neuropsychopathology expert. Unlike short-form content that oversimplifies complex conditions, forensic neuropsychopathology looks at what the science actually shows. Not opinions, not stereotypes, not even movie villains, but empirically grounded evidence. So let's get into this conversation and discuss it in a way that's more accurate and engaging. Psychopathy is mostly associated with neurodevelopmental differences. And what this means is we're looking at individuals that might have some different brain structure development from an early age. Research consistently shows that people who possess psychopathic traits show abnormalities in the following areas, like the amygdala, which is responsible for fear and emotional processing, the prefrontal cortex, which is a region that is responsible for moral reasoning, impulse control, and decision making. This helps explain why individuals with psychopathic traits often show shallow or absent emotional responses, lack of empathy or remorse, calm, calculated behavior, even in high stakes or violent situations. And this isn't about being evil, it's about how the brain processes emotion, consequence, and social cues. On the other hand, sociopathy is heavily linked to environmental and psychosocial factors. This often includes severe childhood trauma, abuse or neglect, chronic exposure to violence, disrupted attachment and social development. And people with sociopathic traits tend to show more emotional reactivity, like impulsivity, difficulty regulating anger, and there's some capacity for guilt or attachment, though it's impaired. From a neuropsychological standpoint, this often reflects acquired dysfunction rather than innate brain differences. So here's where it gets serious and where forensic neuropsychopathology plays an essential role. These differences can impact criminal responsibility, risk assessment, competency to stand trial, sentencing and mitigation, treatment potential, and even public safety concerns. So for example, two people can both possess antisocial behavior, and I'll discuss more about antisocial personality disorder in a different video, but going back to two people having the same antisocial traits can have two completely cognitive profiles. And within the legal system, that distinction alone can mean the difference between, rehabilitation versus punishment, mitigation versus full culpability, and accurate risk prediction versus catastrophic error. I've created a few videos about forensic neuropsychopathology and how it's involved with my 3-volume series. Here's a couple of videos here. So to give you a brief understanding of what it is, it's simply a multidisciplinary approach that focuses on how brain behavior and mental health conditions impact the brain in terms of decision making and how that affects the legal system. Now, when we're looking at forensic neuropsychopathology, this discipline asks deeper, complex questions like, how do brain abnormalities affect moral reasoning? When does impaired emotional processes impact legal responsibility? Where is the line between explanation and excuse? And then instead of, relying on labels alone, the field uses neuropsychological testing, brain imaging, medical history, mental health history, developmental history, and behavioral consistency over time. And this approach is evidence-based, it's not trend-based. This is exactly why psychopathy and sociopathy are examined in Volume 2 of my series. In Volume 2, I don't just define the terms, but I analyze brain and behavior relationships, medical and neurobiological evidence, forensic and legal implications. And this is where mental health, the brain, and the justice system collide. And this relationship is heavily misunderstood and completely ignored in the mainstream media. The problem with the evil narrative, often one of the biggest myths, are people with psychopathic traits are simply monsters, and that's not true. And that belief can undermine accurate risk assessment. It can lead to poor legal outcomes. It can even increase stigma and prevent evidence-based intervention. So forensic neuropsychopathology doesn't excuse harmful behavior, but it demands that we understand it accurately. And because we misunderstand the brain, we misunderstand responsibility, danger, and rehabilitation. Sociopathy and psychopathy are not interchangeable labels or terms. They represent different developmental pathways, different brain behavioral patterns, and different forensic implications. And if we want the truth instead of trends, we need to move beyond pop psychology and into empirically grounded scientific understanding. And that's what forensic neuropsychopathology is all about. If you found this breakdown helpful and would like more content on the brain, behavior, mental health, and the legal system, like this video and subscribe to our channel. I go deeper than surface level psychology, and I definitely base my knowledge and intent on evidence-based insights. And I get a lot of topics from my series on forensic neuropsychopathology. However, if there is a topic that you're interested in and would like for me to break it down, just drop it in the comments below. See you in the next one.